Navy SEALs and their predecessors.
Legislation to require drug testing for anyone receiving public assistance passed its third legislative committee today in Tallahassee. This measure would require testing to receive benefits. But as Mike Basilinda reports from our exclusive Capitol News Bureau, even the legislature's own staff says this bill could be questionable constitutionally.
Since early January, protesters have been begging lawmakers to leave Medicaid alone.
Leave our services the way they are.
They've carried signs and pleaded with lawmakers, but their cries have been muffled by the $3.8 billion budget deficit. House Republicans say they can save $1 billion by putting Florida's 3 million Medicaid recipients in HMOs or other managed care programs.
I think that the leadership has the right concept and are going in the right direction.
The governor's on board.
We've got to make sure we spend the money better.
But Democrats say quality will suffer.
By privatizing it, we're taking and putting the care of these patients into the hand of those private companies, and we know the private companies' priority is making a profit.
With a GOP supermajority in the legislature and a Republican governor, no one expects this bill to fail. But the Capitol is just the first stop. The state will still have to get a waiver from the federal government to implement the changes.
Hey,
Doc.
The state will have until December to get the waiver. Supporters of the bill say if the feds won't sign off, Florida will do something no state has ever done. Start its own scaled-back Medicaid program. Social service advocates say that would be
devastating, not only to the people it serves. Remember, the majority of people in Medicaid are children, and behind that we have frail, elderly people.
If the state pulled out of the entitlement program, it would lose $13 billion federal matching dollars. In Tallahassee, Whitney Ray, WPTV News Channel 5.